I remember going to the dentist when I was about 12, and my mother said, "Why don't you become a dentist?" It was always in the back of my head. And when I went off to college, I really liked the hard sciences. I looked into medicine, I looked into dentistry, and I found my calling, and I went to dental school. So when I was in dental school, I wanted to understand pain, to be able to sedate patients, to be able to do complicated implant constructions, and currently that's what I've been doing for the last 15 years. But even then, after that, I understand that there's a patient attached to the end of these problems. And some of these patients have multiple problems. And I just felt a penchant and desire to want to get involved and help people have a functional and cosmetic outcome, because I realized there's a huge need out there. People need someone with a lot of skill sets that can do these things for them. And I suppose that's where my passion came. I'm a little bit of a learning bug, and implantology requires that. After all of my training at Ohio State, a hospital residency up in Cleveland, and then I went back to Ohio State to complete a residency, become a specialist, I decided to come back to Mansfield, Ohio to give back. I practice in Mansfield, Ohio. I've been here for 2 decades. I treated a lot of patients over the years, and to see their smile at the end of the case, that's what made me want to do what I do today. And then I slowly gravitated towards doing implant constructions. When patients come in, they have multiple problems, and a lot of patients are medically compromised. So to have a better, strong handle on acute care medicine, to be better at venipuncture, to draw blood, to make growth factors for bone grafting, basic phlebotomy background, surgical training, prosthetic training, all these things are needed to be a top-notch implant doctor. What I started doing was I started training, and I learned how to bone graft and place implants. And over time, that's brought me to where I am at today as an implant specialist. Remember, it's a team. This isn't a one-person show. Implantology requires people with skills. Some patients come in, they need perhaps a teeth and a day implant construction. So we will plan the case from the beginning to the end for them. And then that smile, that's when it hits home.